Dolcolax 12 Plus is a medication used to relieve constipation and irregular bowel movements. The active ingredient in Dulcolax is Bisacodyl, a stimulant laxative that works by stimulating the bowel muscles to promote bowel movements. This helps to soften the stool and make it easier to pass, providing relief from constipation. Dolcolax 12 Plus tablets are typically taken orally, and the recommended dose for adults and children over 12 years old is usually 1 to 2 tablets taken at night to produce a bowel movement the following morning. It is important to swallow the tablets whole with water and avoid crushing or chewing them, as this can cause stomach irritation. Common side effects of Dulcolax include abdominal cramps, nausea, diarrhea, and a feeling of discomfort in the stomach. These side effects are usually mild and temporary. If they persist or become severe, patients should contact their healthcare provider. More serious side effects are rare, but can include severe dehydration and electrolyte imbalances, which require immediate medical attention. Patients should inform their healthcare provider about any other medications they are taking, including over-the-counter drugs and supplements, to avoid potential interactions. Dolcolax should not be used for extended periods without medical advice, as prolonged use can lead to dependency and reduce bowel function. To ensure safe and effective use of Dolcolax 12 Plus, patients should follow the healthcare provider's instructions carefully and maintain adequate hydration. Increasing dietary fiber and engaging in regular physical activity can also help manage constipation. If constipation persists despite treatment, it is important to seek medical advice to rule out underlying conditions.